Okay. Any more business you can think of? No? Okay. So now I get to introduce Diana, which is why I have this paper, because her bio is more impressive than this little brain could keep up with. So first of all, she's a very dear friend, and she is passionate about this topic, and many of you know that through personal interaction with her, having met her, having heard her speak before. She's a frequently interviewed consultant to the media, as well as trainer and presenter on all facets of perinatal depression. She's also an author. She's written The Journey to Parenthood, Myths, Reality, and What Really Matters. She's also written a training manual for clinicians and childbirth educators called Transition to Parenthood, a course for expectant parents. She is a past president of Postpartum Support International, which is the largest volunteer organization nationally and internationally dedicated to working with these mothers. And she is also currently on the president that can happen when a mother is mentally ill. She's the 2007 recipient of the Jane Honickman Award for her outstanding contributions to the field of childbearing illness and maternal mental health, and the 2009 recipient of the Welcome Back Lifetime Achievement Award presented by Eli Lilly. And I will brag on her and say that she turned around and donated that entire award to the Perinatal Task Force. So she clearly is dedicated. These accomplishments all underscore her passion and devotion to helping women who are suffering from postpartum depression, and we are very lucky to have her with us today. So,
Thank you very much. I'm wired for sound here because we're videotaping this, so I hope I don't explode. But anyway, I have something on my back here. Such an important, comprehensive topic and so much to say. And what I want to focus on today, as you can tell by the title of today's presentation, is the language of postpartum depression. You know, if I were to line all the women up in this room, line you all up together, you all had postpartum depression, you probably would all look a little different. Your symptoms might look a little different. You know, the cluster of symptoms that you have, the intensity of those symptoms, it might all look a little different. But in my clinical experience over the years, one of the things that I find kind of across the board, regardless of which symptoms, how intense, the duration, is how women talk about their feelings of being depressed. For those of you who are familiar in this area, of course, you know the symptoms that we talk about. When we look at perinatal depression, there are lots of different ways in which the depression may present itself. First of all, we know that about 10% of women are going to be experience some kind of mood or anxiety-related disorder during their pregnancies. So there goes the myth that women are blissful and glowing during that time. And we know that about 15 to 20% of women, and we think in some cases may even be higher, because these are the statistics of the women who come to us and who talk about it, are going to have postpartum depression with this overwhelming anxiety. Some women are going to come to us with postpartum depression where the presenting symptoms are that of obsessive behaviors, compulsive behaviors, things like repetitive checking, fears of contamination, counting bottles, counting diapers. We know that other women may experience panic attacks that look just like the panic attacks that those of us in the field know about, you know, feeling like you're dying, feeling like you're having a heart attack. That's about 10% of women. We know that some women will actually experience post-traumatic stress-like symptoms, and that that can be triggered by the birth itself, and trauma is definitely in the eye of the beholder. So it looks like a perfectly wonderful labor and delivery for one woman may be a traumatic experience for another woman. And I actually had a case like that many years ago where, you know, we all have that idea in our minds about the perfect delivery. What's the perfect delivery? Do you know? I don't know where it exists, but somehow in our culture we have the idea of the perfect delivery. about 4 hours, right? No episiotomy, no epidural, right? 2 pushes, no pain, 2 pushes, baby's out, right? Off the table and home you go. Well, I had a woman probably about 5 or 6 years ago who came to me with that exact delivery. And how did she describe it? As a train going down the tracks at 80 miles an hour without anyone who could stop it. And for her, it was a traumatic experience. So much so that she actually had post-traumatic stress disorder following this birth. We also know that the act of giving birth can trigger early childhood trauma. So all these different ways in which women present symptoms. But when we're in the room with someone, when we're listening, most of the time women don't tell us, I'm having overwhelming anxiety, you know. They don't say to us, I feel like I can't cope. They don't really say to us, I'm feeling extremely inadequate. Okay? They won't even say to us, certainly won't say to us, I'm feeling suicidal, or I'm having these horrible thoughts, these destructive images, because that's such a cause of shame for so many women. So they won't come to us with that list of symptoms that us as clinicians know and have learned and studied and talk about all the time. They will come to us with words. They'll come to us with phrases. And my experience has been that almost across the board, they are the same words, the same phrases, over and over and over again. You know, it's kind of like if you go to the doctor and you say, you know, I have a headache and I have chills and I have a fever and aches and pains, and the doctor says, well, it sounds like you've got the flu, so this is what I'm going to do, or this is what we're going to do to get you better. Same thing with women. They'll use a certain word, they'll use a certain phrase, you know. And it's interesting, I brought this today, and I'm certainly happy to pass it around. It happens to be the postpartum depression screening scale that was designed by a colleague of mine, Cheryl Beck. And Cheryl is a nurse. She teaches at University of Connecticut at Storrs, very well known in the field. And she designed this. It was based on qualitative interviews with women. And the questions that are asked here actually are based on the way women describe their state of being, how they describe their mental state, how they describe their behavior. So it's a fascinating screening tool. And in fact, she talks about the fact that when we look at postpartum depression, it's really kind of a 4-stage process, which she calls the 4-stage process of teetering on the edge. And in the first part, she talks about encountering terror. And that is the woman's sense of this enveloping fogginess, her increasing anxiety, her obsessive thinking, her relentless, just relentless restlessness, agitation. Many women will describe it as feeling as though they've had coke injected into their veins, into their bloodstream, because the anxiety is just bubbling over. When she moves into her second stage, which she calls the dying of self, that's when she talks about the sense of alarming unrealness that many women experience, the going through the motions that women will talk about, kind of a mechanical mother, okay, the going through the motions, guilt, okay, feeling as though they are bad moms, that they don't know what they're doing, and contemplating suicide, contemplating their own destruction. As they move into the third stage of struggling to survive, women are trying to battle the healthcare system. They're looking for solace at support groups. They're praying for relief wherever they can. And as they move into the fourth stage, which is regaining control, the period of recovery, it's kind of a guarded recovery. And what we see among many women is this sense of lost time. And there is a period, I heard someone here talk about grief and loss. There really is a period of grief, of loss, of mourning over what has been and what could could have been, and the time that I've lost with my baby, and how am I going to make that up? And is my baby going to know that I wasn't there or not available? So these are the things that she talks about. Some of the words that I hear are things like, and phrases, are, no one has ever felt as bad as I do. And it's one of the ways in which women describe their sense of helplessness, which is a symptom of a major depressive episode. Women will talk about feeling as though they've made a terrible mistake. And of course there's a difference between that kind of, oh my gosh, what was I thinking when I decided to have a baby, because you're so overwhelmed with this enormous transition, and what we hear from women with postpartum depression, which is, I never should have done this. What was I thinking? I've gotten myself into this place and I feel so very trapped. I feel so very trapped. As a matter of fact, I was sitting in the office with a woman just yesterday who's got 4 children under the age of 5. You think she has some postpartum depression? Yes, she does, for many reasons. But one of the things that she talked about was her overwhelming sense of guilt that, you know, society tells us that it doesn't matter whether you're the mother of 1 or you're the mother of 8. You're supposed to be thrilled. You're supposed to be enthralled. You're supposed to be limitlessly available. You're not supposed to complain. If you're exhausted, it doesn't matter. And so this young woman is carrying all of that inside of her. And so when I was able to kind of verbalize for her and say, I'm wondering whether you have regrets, she broke down and started to cry, because it was the one thing that she felt she could never say to anybody, is that I wish I didn't have all of these children. She felt like if I could say that, if I say that out loud, everybody's going to think I'm a horrible, horrible mother.